Hello, everyone. Thank you so much for the invitation to be here to present to you about hepatitis B on World Hepatitis Day. My name is Alise Freeland, and I'm the Associate Director of Public Health Research at the Hepatitis B Foundation. And today I'll be talking about addressing and understanding health disparities associated with hepatitis B. I'd like to first encourage you all to view some of our Just Be storytelling or Be the Voice storyteller stories. These are available as videos online. And as you'll hear about more later, those living with hepatitis B experience significant challenges and health disparities associated with their diagnosis. And this can range from experiencing isolation or rejection from the communities that they're a part of, or being treated differently within the healthcare system, or being denied employment opportunities or educational opportunities because of a hepatitis B status. Additionally, there are other challenges associated with hepatitis B in some settings, like accessing medication or treatment, for example. And it's really important for us to understand the lived experience and hear from people who are directly affected so we can work to address their challenges and also better understand their real life experiences. Having this understanding allows us to be better public health professionals and medical professionals in the field, and allows us to have empathy and understanding of what's actually going on the ground. So I've linked a story that I think will resonate with you, particularly today on World Hepatitis Day, Nathaniel's story, and he's from Nigeria and shares about his experience dealing with hepatitis B, challenges accessing treatment due to the cost, accessing medication, and a doctor that he can regularly go to because of the costs associated with that management. So I think it's really important that you take an opportunity to view this video. I won't view it for us today because I think you can do that on your own time, but definitely want to encourage you to check his story out as well as others from around the world. You can do that by going to our bethevoicehepb.org website, which has a ton of stories from people in the United States and all over the world. We'll continue to release more stories, and this is a way that we work to reduce some of the stigma and discrimination associated with hepatitis B and to provide a more comprehensive and well-rounded understanding of the lived experience. So I encourage you to check those out. So in terms of what I'll be talking about today, I'll first talk about hepatitis B, particularly the burden of hepatitis B. I'll go into some of the lived experience examples that we have from our storytellers. I'll talk a little bit about hepatitis B epidemiology, health disparities associated with hepatitis B. We'll zoom into the stigma and discrimination globally associated with hepatitis B. And then I'll share some resources for your practice as you are future pharmacists. I hope that you'll take some of the content that I share with you today into your future careers. Just a little bit about hepatitis B. As you may know, it is a viral infection of the liver that can lead to cirrhosis or liver cancer. And in the United States particularly, and really globally, it impacts Asian, Pacific Islanders, and African communities at significant burdens. There is no cure for hepatitis B, but it is preventable with highly effective vaccinations. Those vaccinations have been around for over 30 years, are extremely safe and effective. And as pharmacists, you hopefully will be administering these vaccines to folks who may be vulnerable to infection. If untreated, with those living with hepatitis B, 1 in 4 will suffer from liver disease or liver cancer. And we do in the United States have emerging challenges related to hepatitis B, particularly related to increases in acute hepatitis B due to the opioid epidemic, as well as new populations becoming infected, particularly because of the limited vaccination uptake that we've seen in the US, which we'll talk about later. In terms of how hepatitis B is transmitted, it can be spread by direct contact with infected blood, from unprotected sex with an infected individual, the use of contaminated or unsterile medical or injection equipment, and it's most commonly spread from an infected mother to her newborn during childbirth. And these infants who are exposed to hepatitis B during birth have about a 90% chance of developing a chronic or lifelong infection of hepatitis B. We do have prevention measures in place that can prevent this transmission from taking place, like the hepatitis B birth dose administered within the first 24 hours of birth, followed by that routine immunization series. which is provided in the United States and in many countries through the EPI systems. So that's definitely a strong way to prevent transmission from taking place. If we look at the global burden of disease, you can really see what I was mentioning earlier. Areas of Asia, the Pacific, and Africa are most commonly burdened by hepatitis B. The red areas show prevalence of greater than 10%. The orange is between 5 to 7%. So you can see there's huge population burdens among the general population. And this is data from 2016, but it's reflective of what we still see today and the population burdens that were known. I will say data and surveillance is really limited in many of these settings. And so these are really based on modeling and estimates, which is a lot of the data that we have for hepatitis B. There's a need to really strengthen surveillance opportunities across the board. If we look at hepatitis B in the United States, it's estimated that 2.4 million people are living with chronic hepatitis B. If we look at by state, and this is a little bit dated data, however, it's still reflective of what we're seeing today. We are also seeing acute hepatitis B, and we saw significant rates of increasing acute hepatitis B in the United States, particularly along regions of Appalachia, directly related to the opioid crisis. You can see from Maine, an example, a 725 increase between 2015 to 2017 alone. There's also barriers within the harm reduction space, particularly with syringe service programs or SSPs. There's a lack of SSP participation in care delivery for hepatitis B, lack of certifying providers at syringe service programs. There's limited staff capacity, education, and training related to hepatitis B, both for vaccination and screening. And there's challenges associated with transportation for the vaccination, which is a really big barrier to making sure that acute rates remain stable and actually work towards decreasing in conjunction with the opioid crisis now. If we look at some of the challenges associated with disease progression of hepatitis B is really unique in that you can actually have a chronic infection and develop liver cancer without any symptoms. And this can happen between 5 to 10% of folks. Those with chronic infection, about 30 to 40% will go on to develop cirrhosis, and some may need a liver transplant, and it could result in death. The biggest challenge is when hepatitis B is not monitored. So people aren't in regular care. The standard of care in the United States, recommended by the Association for the Study of Liver Disease, is care monitoring at every 6 months or potentially every 3 months, depending on where the person is and if there's any level of liver damage taking place. And this monitoring requires some imaging and some blood work to really monitor the liver health. If we look at the care cascade, this is also from a couple of years ago. However, the numbers are very much the same in terms of where we are. So as I previously mentioned, we have just over 2 million people living with hepatitis B. The number actually aware of their infection is only about 400,000 to 600,000. So that's a really small number compared to the actual burden. The number eligible for treatment is 350,000 on average. Those entering into care is around, on average, 100,000. And then those that are actually receiving prescriptions for hepatitis B is only about 50,000. So only about 30 to 35% of Americans are actually diagnosed with hepatitis B, and less than 10% are actually treated for hepatitis B. So you can see there's significant gaps in the care cascade, and this is also reflected in the global burden, and there are even more stark barriers to care within the global space. In terms of screening, as I mentioned on the previous slide, only about 10% or 25%, somewhere around 25 to 35% are actually aware of their infection based on modeling estimates, and less than 10% are able to access care and treatment. There's significant barriers and disparities associated with lack of testing and screening in the US, and this has to do with stigma, discrimination, and misinformation reported. And then there's significant barriers associated with accessing treatment, like cost, language barriers, and then challenges navigating the healthcare system, and I'll talk a little bit more about that later. If we look at some of the health disparities associated with hepatitis B, Asian American and Pacific Islanders carry about half of the chronic hepatitis B burden in the United States. Among AAPI and foreign-born African community studies, we see infection rates between 5 to 15% in the community populations that we're screening, which is a significant burden, and really just demonstrates that a lot of people are falling through the cracks in terms of the healthcare system, and testing is not really taking place. AAPI and African communities also face significant mortality rates that are 6 times higher on average compared to other populations. And you can see the data here. It's about 13 times higher in Vietnamese men, 8 times higher in Korean men, and 6 times higher in Chinese men, for example. And there's also challenges accessing care for these individuals as well. Challenges navigating the healthcare system, economic and social marginalization, underinsurance, as well as cultural and linguistic barriers that take place. There's also barriers to hepatitis B prevention and screening for African immigrant communities. This is data based on a study that we did looking specifically at this population. And this figure really shows the interconnectedness of some of the barriers that the community faces. There's deep-rooted religious values that affect healthcare access and limit one's access to healthcare. Oftentimes having or discussing disease is sometimes considered taboo, and health is something often to be kept quiet about and not really shared or discussed in the community. Sometimes individuals prefer traditional medicine rather than westernized medicine of prevention ideology. The complexity of the U.S. healthcare system also adds barriers such as language, health literacy, provider trust, racism, costs, and navigating the health system. There's also perceptions towards prevention, which are limited, and this is really typically considered a Western idea, which is not common within the African context. People tend to only go to the doctor when they're unwell or have symptoms of something. And with hepatitis B specifically, when one has symptoms, it's often too late to do anything about it at that time because you're dealing with potentially end-stage liver disease, for example. There's also low hepatitis B related knowledge in the community, which also leads to common myths and misconceptions, particularly around how hepatitis B is transmitted. And this all results in confusion associated with the disease, lack of knowledge, lack of accurate information, and leads to the fear of the unknown and also hepatitis B stigma, which is really common in the community and obviously will impact one's health outcomes and whether or not they seek care for specific screening. So I'd like to go through a specific case study, specifically looking at discrimination and stigma associated with hepatitis B globally. And what we've identified is that people with hepatitis B often experience some sort of discrimination that denies them employment or educational opportunities and results in unfair treatment at work or school, or limits their ability to immigrate to certain countries, and in some cases prohibits them from serving in the military. And this is something that is even in existence in the United States, for example. Discrimination specific to hepatitis B has not widely been documented. There's only been a handful of studies published out there from China, for example, because they do have a long history of discrimination and trying to enact policy to prevent this discrimination from taking place. And this work that we're doing at the Hepatitis B Foundation aims to really define discrimination, and also it aims to define discrimination and really document it occurring. So there's multiple ways that this program is really working to document this discrimination taking place. The first is through key informant interviews, which I'll talk about some of the results of. In May of 2021, we launched a discrimination registry, and this is similar to some of the anti-Asian hate registries that have taken place to really document racist acts against AAPI communities. We have launched something similar, really documenting the lived experience of discrimination and reporting when individuals experience this type of discrimination, and also have an email consult line to help individuals that have experienced this to try to provide recommendations and guidance on how to deal with that, and also just supportive services in that space. We have a stakeholder working group, which is made up of people living with hepatitis B and community advocates on the ground in various spaces where we know discrimination is really common. And ultimately, we're working towards addressing and documenting this to create policy change for folks who are living with hepatitis B to really stop this negative impact associated with hepatitis B from taking place on the ground. So what we've seen so far is that we've heard from people all over the world that have really significant experiences associated with discrimination. You can see we've heard significantly from the Philippines, from Nigeria, from India, Pakistan, the United States, Uganda, Bangladesh, Myanmar, and many other countries. You can see the list here who've directly experienced discrimination associated with hepatitis B. Individuals were asked where this discrimination was taking place. Many expressed that it was taking place within employment-related activities. So it was inhibiting individuals from seeking employment opportunities or particularly working abroad. We hear a lot, particularly from like the Philippines and Nigeria and other parts of Asia and Africa, for example. Individuals go to work in the UAE, for example, or other Gulf Coast countries to support their families. They go often as like domestic workers, for example. And what's happening is when people are applying for visas into the UAE or the Gulf Coast countries, they're being denied admission because of a hepatitis B screen being positive. And this discrimination also is reflective in their home countries in some cases as well. And it can impact their own employment in their own communities and countries too. So you can see it's having a significant impact on folks. When we look at the demographics, you can see that mostly younger populations are being affected. So between the ages of 18 to 49, most are male, so potentially breadwinners of families, and they personally experience discrimination themselves. I think it's best to take a look at some quotes to really try to understand the true lived experience associated with this type of discrimination taking place. You can see this quote here. It happened in the state of Qatar. I had just gone to work as a cleaner and it was mandatory for everyone to get screened. I got screened and was highly discriminated. I was given 3 days to leave Qatar or face deportation. This is something that we hear a lot, particularly again, related to those Gulf Coast countries and then discriminating against people. Another one said this top quote, when I'm applying abroad as a domestic helper bound for Kuwait, I found out my hepatitis B surface antigen is reactive and they told me that I'm not fit to work. I'm very frustrated. Another one shared at the bottom here, I'm applying for the Namibian Defense Force career. We went for a medical test as the last interview, only for the doctor to tell me I'm unfit and can't go for such a career because I have hepatitis B and will infect others. And then in reality, you know, the risk of transmission is really limited, especially with most military forces when the vaccination has been widely implemented and utilized within those spaces. So risk of transmission is really low. And so there's really no reason that people should be denied opportunities to serve in the military, for example, or other police forces or spaces because of hepatitis B, because we do have such preventative resources. Overall, from all of the findings that we're seeing from the discrimination, we're finding specific themes and types of discrimination, as well as the impact that it's having on folks. In terms of the types of discrimination and the themes that were emerging, it's educational-based discrimination, employment-based discrimination. A lot is related to international visas or travel discrimination, as well, and then also healthcare worker discrimination. So things taking place within the healthcare system to discriminate against people or treat people differently with hepatitis B. So it's again that stigma, that discrimination coming up into play within the healthcare systems themselves. And really, this has a significant impact on the quality of life for those living with hepatitis B. It impacts their economic stability. It leads to poor health outcomes, meaning that people are less likely to seek healthcare, particularly when they're going to be discriminated within a healthcare system. So as pharmacists, as future pharmacists, you know, really making sure you're providing empathetic care for those living with hepatitis B and all other infectious diseases or diseases themselves, because it's really important to try to avoid these negative consequences associated with this discrimination and stigma that's taking place. Family relationship instability, social exclusion, loss of employment, people being deported because of hepatitis B, marginalization, and even suicide in some instances, particularly younger folks. And we've seen this happen with examples coming out from China, for example, of a person who was in university studying. And that's, we've seen that happening a few times, unfortunately. And overall, we've seen that this data really demonstrate that hepatitis B discrimination has a significant impact on the quality of life for those living with hepatitis B. Discrimination can occur at various points in life, so it can occur in a cyclic nature from once somebody's seeking education to if they're denied education, then they'll try to seek a job or try to apply for a visa. And then they might experience that discrimination happening again and again, and it really has an impact on their overall quality of life and well-being, which is really unfortunate and really just ultimately a human rights issue and a social justice issue, as it shouldn't be happening or taking place in the community. As we work towards goals towards elimination of viral hepatitis by 2030, these are the WHO elimination goals towards improving testing and prevention. We really need to also make sure that with this potential enhanced testing, we have protections in place to prevent this discrimination from taking place, as well as its consequences associated with those with hepatitis B. So making sure that there's policy in place to protect folks, but also if somebody does experience discrimination, there's a way for them to report that discrimination in a way that will fight against that discrimination on their behalf. So in terms of what you can do as future healthcare professionals and potential leaders in your field, really promote the importance of screening and vaccination. In the United States, for example, we have new screening and vaccination guidelines that have just been released over the past couple of years. The vaccination guidelines were released last spring, and the screening guidelines were released just last month. And the vaccination guidelines state that everyone between the ages of 18 to 59 should be vaccinated. So it's a universal vaccination recommendation. And then those 60 and older should be vaccinated based on risk factors. So really, it's a wide blanket statement to promote vaccination here. And then the screening vaccination just came out that stated everyone should be screened for hepatitis B at least once. And so we really want to work to do a better job at reducing that care cascade disparities that are associated with hepatitis B screening and vaccination. And you as a pharmacist have a role to play in that space to really promote everyone knowing their status and also vaccination as prevention. We can also work to improve education and awareness at home and in our global circles. We really live in a global world with social media and everything. So as this is World Hepatitis Day, I encourage you to reshare, retweet, or just tweet about hepatitis awareness, spread the word about the importance of knowing one's status, knowing the importance of not discriminating against folks living with hepatitis B, and really just helping us promote and uplift the message about hepatitis B prevention and screening. You can also help document the lived experience with hepatitis B, share stories, lift up voices of those living with hepatitis B, and also finally help advocate for those living with hepatitis B to improve resources, access to care, and encourage the broad implementation of these new screening and vaccination guidelines in the United States, for example. I want to briefly talk about the importance of prevention and preventing chronic hepatitis B infection. This is the International Hepatitis B Vaccination Schedule. We also have other vaccination schedules available on our website, but this one is a really important one to note. Currently, for people of all ages, it's recommended to prevent hepatitis B that the birth dose be given within 24 hours, and then at least 2 subsequent doses. If you're looking at the pentavalent or the hexavalent vaccination series, you're looking at 6, 10, and 14 weeks of age to prevent hepatitis B. It's not necessary to revaccinate or boost at this time. As long as somebody receives those vaccinations, they have a great chance of avoiding hepatitis B infection and ultimately avoiding liver cancer in the future. In the United States, we've had universal vaccination for infants since 1991, and it's recommended by the U.S. Centers for Disease Control and Prevention. Only about 30% of adults are fully vaccinated against hepatitis B. There's really low awareness among providers and patients. There's financial barriers to access, and then there's complicated risk factors assessment for providers. So we're hoping that these new guidelines for universal vaccination for 18 to 59 will help address a lot of those risk factor assessments and reduce some of the barriers to accessing vaccination. You can see some of the vaccinations that are available listed here. As I mentioned previously, we have a universal one-time hepatitis B screening for adults 18 and over, which is really exciting. The universal screening would avert 7 cases of compensated cirrhosis, 3 cases of decompensated cirrhosis, 5 cases of hepatocellular carcinoma, and 2 liver transplants, and 10 hepatitis B related deaths per 100,000 screen, which is really significant. And so it's really exciting and encouraging to see that the CDC is on board with really universal screening for hepatitis B. Now it's a matter of us as healthcare professionals to really advocate and make sure that this gets implemented in practice. So really the ultimate goal here is getting tested and encouraging others to get tested and know their status, and also really within your pharmacy networks, groups, sharing the information about these updated guidelines for both vaccination and screening. Making sure that this is disseminated out into the provider spaces is really essential. I want to leave you with some additional resources that might be helpful for your practice. There's provider-focused resources that are listed here, and I'm happy to share my slides with your team. There's also public-focused resources here as well. We have vaccination fact sheets. We have social media toolkits, and then we also promote the National Immunization Awareness Month. But you can see here, there's a ton of resources that really encourage standing orders for vaccination and really working to reduce the burden and barriers associated with hepatitis B. Here's some additional resources that might be helpful for you. These are all available on our website and fact sheets. These are some of the infographics that we've created over time, things that you can share today as it's World Hepatitis Day on your social media channels. We definitely encourage you to help promote and spread the word. Here's some vaccination cards that we have. These are great for the pharmacy, for example, to serve as reminders for folks. This is also the vaccination schedule as well, which is another great resource. If you're interested in learning more, you can feel free to reach out. My email is listed here. You can also connect with us on our social media channel. We'll be posting today a ton on our website, and I encourage you to also post and reshare. We love for others to get involved and help us promote and spread the word about the importance of hepatitis B and hepatitis B screening. So I thank you so much for your attention and for being here and for the opportunity to speak to you. And I hope this information was helpful to you and your future practice. Thank you so much.